Have you heard of the Access to Rare Indications Act? If this bill is passed, insurance companies must provide an expedited appeal process for rare disease patients taking certain off-label medications. This proposed bill is incredible and can really help the rare disease communities. However, there are still two main reasons why people with PSC would probably still have a very difficult time accessing oral vancomycin. Number one, insurance companies still would not have to look at the weight of evidence, which means that they can pick and choose individual pieces of evidence like the neutral Deneau paper or the AASLD guidance if it's published to deny coverage of oral vancomycin. And number two, the burden of proof is still on us as the patients, which means we're the ones that have to do all the research and provide a case to the insurance company explaining why they should cover oral vanco. But I have some good news. We have drafted some language that we would love to get implemented into this bill, but we need your help to contact your Congress members and senators to get this bill passed with the modified language. But what does this modified language do? Well, number one, it would make the insurance companies have to look at the weight of evidence, so they can no longer pick and choose individual pieces to deny coverage. And currently there's a lot of evidence out there showing that oral vanco for PSC is pretty effective. The modified language would also force insurance companies to have the burden of proof, which means they're the ones that have to provide a case explaining why they're denying coverage. Go to my blog post for instructions on how to ask your legislators to sponsor this bill with the modified language.